Hello, and today I will be discussing heart failure. So, what's heart failure? Heart failure is when the heart is unable to pump the blood throughout the system, so decreased output. When there's a decreased output, when there's a decreased output, uh, the heart releases some of the enzymes such as adrenergic peptide, endothelin, and prostaglandin. These ones we can see on labs if we order them. Why does the heart failure usually happens? Well, there's multiple reasons. Cardiomyopathy can occur probably from like a strep infection. Um, then person can be born with heart defects. Systemic hypertension, well, that's over the years that can happen. Pulmonic hypertension, all COPD, asthma, valvular heart diseases. Well, that's again streptococcus infection, fever, thyrotoxicosis, iron overload, hypoxemia, anemia. So the less, for example, red blood cells there is that are able to carry oxygen throughout the body, the more heart will have to work to deliver O2 to the cells and to remove um, carbon dioxide. The more heart has to work, the more it will be hypertrophy and leave less space for the blood to fill the ventricles. Cardiac dysrhythmias, and antiarrhythmic medication all can lead to the heart failure. So when when heart fails, the body stimulates two pathways. The first pathway is the brain, where epinephrine and norepinephrine are released, uh, and they try to constrict the blood vessels and stimulate the heart to uh, pump harder, which further exacerbates the heart failure. So, with there's such thing as down regulation, where the more epinephrine is released, the more receptors are affected, and the receptors will start to dwindle down, um, and all this work of the heart will lead to further damage to the myocardial cells. Um, and then the second pathway is where the kidneys release renin, and renin splits our angiotensinogen into the angiotensin 1. Then ACE from the lungs breaks it down to angiotensin 2, and angiotensin 2 stimulates the vasoconstriction of the blood vessels. It stimulates the release of aldosterone from the kidneys. So kidneys release this aldosterone. Aldosterone stimulates thirst centers in the thalamus, and then also stimulates the kidneys themselves again to retain sodium and fluid. So fluid retention occurs. Also, angiotensin 2 stimulates the. Okay, so this is the brain. This is the brain stem, and here we have our posterior pituitary gland, and this posterior pituitary gland releases antidiuretic hormone. So angiotensin 2 will stimulate that antidiuretic hormone to be released, which does what it retains fluid. it affects the kidneys again, and asks the kidneys to retain fluid by affecting the collecting duct. So here we have our nephron, and it creates, so antidiuretic hormone creates these little tubes in a collecting duct, tubes that retain the water, send it back to the system. Okay, then we have this combined effect with adrenaline peptide, endothelin, prostaglandin. They are all increase the preload and increase afterload, which increases the stress on the heart. And I think, okay, so workload on the heart increases, and it further decreases cardiac output and exacerbates the heart failure. So when somebody has a heart failure, it's a good idea to intervene in any of these pathways, whether it's going to be decrease the decrease our epinephrine release, decrease renin, or anywhere along this pathway, or even release of antidiuretic hormone or vasodilate. But mainly to block these pathways, we can help the person with heart failure. We can at least stabilize the cardiac output, or at least can prevent exacerbation. So meds will help, although we have to consider the side effects. But before going into medical medicine and start treating it, how about some lifestyle changes? Lifestyle changes. That would help. Okay. So let's go to signs and symptoms. Signs and symptoms of heart failure. Well, so the main two things, we have fluid accumulation in the body. So when fluid accumulates, we will have swelling in the extremities. Yes, the hands and feet are affected. Also, since we have less cardiac output, less warm blood will be delivered. Warm blood and O2 will be delivered to the hands, and their hands will be cold. And if you will attach the pulse oximeter, it will not give you good reading. You'll see something like 75% to 83%. So warm up the hand to get a better reading. Okay, also, so feet, dependent edema. So you will see +3, +4 edema that starts in the feet and moves upwards, even to their scrotum. So, for example, it's a male, and the scrotum will enlarge because it will become edematous. So might have to maybe elevate it. Also, the fluid backs up. It keeps coming. It keeps coming from the legs up, and it will accumulate near the liver, back up in that venous system. So the backup in the venous system will affect the liver. The liver will swell up. Also, the spleen will swell up. There's a hepatic reflex test that is done where if a person pushes on where the liver is underneath the ribs, pushes with their hand for about 1 minute, then fluid will back up so much that the jugular venous distension will occur 1 centimeter. Okay, 1 centimeter. And it means it's positive. 1 centimeter jugular distension is positive effect. Positive result for hepatic reflex. Also, since the liver accumulates more fluid in it, it will malfunction. And so the main thing, one of the things that it does, metabolizes the drugs, but it also produces the albumin. It produces albumin, which is the protein that the body uses for catabolic reactions, anabolic reactions. So that will not be produced. If there's less albumin in the body, it will affect the person again will swell, but swell in their abdomen because the fluid, because albumin in the blood usually has the osmotic pool of fluid and keeps the fluid in the system, in the blood vessels. So when a person does not have the albumin, fluid has nowhere to be but to move to the gut, and the person might have the rounded, swollen, pregnant-like looking abdomen, and it's called ascites. Also, when the fluid backs up into the in this whole vascular system, venous system, after the liver, there's a hepatic portal system that connects to all the intestines. Since it backs up, it also will move into the abdomen. That fluid will move out of the blood vessels that supply the gut and exit into the abdomen. So ascites will occur from two things: fluid backing up in venous system, and also low albumin. Very, very disappointing. So enlarged liver, urine frequency during the day. Oh, so since a person has more fluid in their body, and if the kidneys are malfunctioning, then we have frequency urination. Oh, decrease urinary frequency during the day. So the frequency during the day decreases, but at night when they lay down flat, oh boy, that's that picture. Okay, so the fluid moves from the legs up towards the head, and there are our kidneys, and fluid starts making its way out of the body. Okay, so that's called nocturia. So maybe no, they might not have to void where they at, but they will be unfortunately forced to go to the toilet several times during the night. Several times. Several times. So next thing, the person will be short of breath because the water accumulates in the lungs and prevents the oxygen exchange. So most likely they'll get a nasal cannula with oxygen tank. They will have cough. When you auscultate with the stethoscope, you will hear crackles that don't go away with cough. Don't go away with coke. It don't go away with cough. And it's going to be bilateral on both sides. Also, since the heart is affected, it will enlarge. So the heart here will get bigger, and let's say it's that big. And the impulse of where you could hear the hardest impulse, it moves from here to here. So pulse of maximum impulse left, lateral displacement of and enlargement of the impulse. So the impulse will move. And of course our murmurs and arrhythmias. Frequently throughout the book they talked about S3, and that is a sound produced when the heart is filling. So lub, I think this two valves are opening, systemic and pulmonic, aortic and pulmonic valves. And okay, and so the tricuspid and mitral are shutting down. That's S1, and then S2 is when our pulmonic and aortic are shutting. That's S2, and then S3 will produce when the heart is filling, right? The blood is flowing inside our ventricle. Right here, it's filling this ventricle, but then it fills it so much that the heart makes it distends, it becomes bigger, and it keeps filling with blood, and then it makes a sound. Makes another sound. And this sound is the S3 that is produced from the heart's, or from the walls. Okay, that is a little bit on signs and symptoms of heart failure, and I will continue talking about signs and symptoms of heart failure in the part 2 video. Thank you for watching.